Hello everyone, welcome to today's webinar, Get Clear Skin Naturally. My name is Courtney and I am the practice manager here at Melbourne Functional Medicine. Before we get started with today's presentation, just a little bit of housekeeping. So obviously we're using Zoom today. Everyone that is joining us will have their microphones muted and also their videos turned off, but we still want you to engage with us using the chat box. So to find the chat box, down the bottom of your little Zoom window, you'll see a speech bubble icon. If you click on that, it'll open up the chat box. We'd love to know where everyone is watching from today. So if you want to pop your town or suburb in there, that would be really good. But also, if you have any questions that come up during the presentation, please pop them and share them in the chat box. And towards the end of the webinar, we do have a question and answer section to answer your questions. Let's get started. There's a lot of reasons why you might be joining us today. Perhaps you had acne as a teenager, but it never went away after high school. Or maybe you got acne quite suddenly as an adult. You may have tried lots of face washes, peels, lotions, the works, but they still have not worked for you. Maybe you've gone to see your GP and they've suggested medications like antibiotics, Roaccutane, or even the pill, and you're a little bit worried about the side effects of taking these. Or you've already tried these medications and they just haven't worked for you. Maybe you've experienced symptoms like bloating from taking antibiotics. Or perhaps you're looking to come off the pill because you want to get pregnant, but you're worried that your acne may come back, or you're looking to come off the pill altogether, and again, worried about your acne returning. If any of these factors resonate with you, you're in the right place. Our goal with this presentation today is to save you money, time, and stress while getting you your clear skin back. Many people spend so much time and money doing the wrong things, and these mistakes are a part of what we'll explain today in this webinar. But first, you're probably wondering, who is Melbourne Functional Medicine? We are a functional medicine clinic based here in Port Melbourne. We help people with a range of chronic health conditions, such as acne, but also things like autoimmunity and women's health. We use a revolutionary approach that gets us 5-star reviews on Google. We'll walk you through our process towards the end of the webinar. And now please welcome functional medicine naturopath and skin health expert, Rebecca Hughes. Rebecca has been working with skin patients for the past 16 years in clinic. Recently, Rebecca won an industry award for clinical excellence as recognition of her outstanding work in the natural medicine field. Today, Rebecca will be sharing the key insights on how you can solve your acne for good. Welcome, Rebecca.
Hi, thanks Courtney for that warm welcome. And thanks to everyone who I can see on the webinar. Thanks for making time in your busy schedule to come and listen to the content of this webinar and how to get clear skin naturally. And before I get into all of the, the technical stuff, I just wanted to share with you that I really understand what it's like. Like if you're dealing with acne as an adult right now, I totally understand your situation, because I developed it at the age of 20, like after high school. So it was quite the surprise to me. And I got sort of funneled down the standard medical route, and I didn't know any different then, because I certainly didn't have the knowledge that I know now. And it was, antibiotics and the oral contraceptive and then Roaccutane. And I didn't know any better, and no one actually took the time to explain any of it to me or any of the side effects to me. But I will explain all that stuff to you today and also talk about solutions. And I just also want you to know that I understand what it's like to deal with the embarrassment that, well, I did anyway, of having acne as an adult, and certainly the annoyance of a lot of unsolicited advice from well-meaning people about diets and hydration and skin hygiene. So don't worry, today I'm not going to give you that kind of advice. I'm going to talk about the real solutions. So this presentation will cover the 5, well, actually, firstly, why everything that you've tried so far hasn't helped to solve your acne. It'll also cover the 5 big mistakes that most people make when they're trying to solve their acne and how to avoid that. The 6 key factors that influence skin health, and maybe you've even tried some of these. What I believe is the most important question to ask yourself about why you have acne at this time in your life, how to solve acne for good, naturally, without any nasty side effects. And please stick around till the end of the webinar so you receive our gift of some recipes to accelerate skin healing. Now, I think that most of the common approaches that are used in general medical practice to treat the symptoms, to treat acne, don't really work, because mostly they're designed to treat symptoms, or they just mask the cause without actually treating the cause. And the cause is the inherent hormonal imbalance that's happening, particularly in adulthood. If you're having acne as an adult, there's an inherent hormonal imbalance that hasn't been addressed. And usually what happens then, once people stop the medications that they've been taking to mask and suppress symptoms, their acne just recurs. And so they find themselves on this frustrating roundabout of medications, of having periods of minimal symptoms whilst they're taking the medicines, and then as soon as they stop, the acne returns. And also, these medications don't deal with the nutritional susceptibilities for skin healing, so what's actually required to repair that damaged tissue. And look, I totally get how tempting it is to go down the medication path. I have no judgment about that, because I know what people are dealing with. And these medications, they make big promises, and they're touted as solutions, like especially things like Roaccutane. And also there is a lot at stake, which is why people try them. It's not just that you're dealing with a skin condition, you're dealing with something that's typically on your face that other people can see, and then there's self-esteem and pride issues that go with that. Yet all of these medicines are generally only a temporary solution. They have side effects that come with them, and I'll go through each of these traditional approaches and why they don't work. So the first big mistake that most people make, well, women make, typically not men, but women make, is taking hormonal contraception to solve their acne issues. So the pill actually works by masking your own hormonal environment and suppressing ovulation. So it just provides a consistent dose of hormones throughout the cycle. And the dose of them is so high that it essentially superimposes a hormonal environment over the top of yours. So this is why for some people with acne that it actually can work to help clear up their acne while they're on the pill. However, it's generally not a solution for most women, because they don't want to be on the pill forever, and then when they come off it, for example, they might want to fall pregnant, then their acne just comes back. Other side effects of the pill include anxiety, weight gain, depression, breast tenderness, and over long-term use, in fact, it can result in some fairly serious fertility issues, like amenorrhea, so where women stop ovulating. So that's a pretty big side effect just from trying to solve your acne. The second big mistake is using Roaccutane to solve acne. Now, this drug is certainly believed to be like the panacea of all acne, but from what I can tell throughout my clinical practice is that it really only works in about half of the cases, and usually takes multiple courses for it to work. In fact, I just spoke to someone yesterday, a new patient, and she's taken 6 courses of Roaccutane and still has acne. So I don't think it's necessarily, it fulfills on its promise. And unfortunately, this drug has some really serious side effects. Like it's damaging to unborn babies. So usually when you're taking Roaccutane, you have to go on the oral contraceptive pill at the same time. And it can cause a lot of damage to your liver. So people taking it generally have to have blood tests before and during and after taking the drug to make sure that their liver is in good health. But also whilst you're taking the drug, and if you've taken it, you'll know this, that people experience everything drying out. So the purpose of the drug is to cause the oil glands to stop secreting the oil, but unfortunately it's not selective. So usually people experience their mouth drying out, their lips drying and splitting and cracking, nasal passages drying out, which is associated also with blood noses, dry, itchy eyes can also happen, and then being really, really sensitive to the sun and easily sunburnt. And that's for the duration that you're taking the drug. So you can imagine if you're taking several courses, that's a lot to manage. The third mistake that is made, I think, in treating acne is the long-term use of antibiotics. And the purpose of this drug is to target a bacteria in our skin called Propionibacterium acnes. I'm just going to call it P. acnes because that's easier. And this bacteria is on everybody's skin, not just on the skin of those people with acne. And it's prescribed for long periods, usually anywhere between 6 and 12 months, the antibiotics. The side effects of that, of course, of taking any antibiotic in the long term is that it disrupts the ecology and the environment in our large intestine. And we've probably all heard about that by now because there's a lot of talk about the microbiome. And the main side effect of disturbing that microbiome is a lot of digestive problems, so bloating, diarrhea, constipation, and then there usually comes some secondary later side effects for women in the realm of urinary tract infections and thrush because, again, that ecology has been disrupted so significantly. The fourth big mistake, I believe, in treating acne is using antibacterial agents on the outside. So that can be things like cleansers. However, also I know that there are prescribed medications like Epiduo, which contain hydrogen peroxide. And certainly there's a lot of very well-known products on the market that contain hydrogen peroxide as well. And again, the purpose of this is to dry the oils up, but also to kill off the P. acnes. Now, I talked about the microbiome in the gut, but there's also a microbiome on your skin. In fact, human beings are just a host for bacteria, so they're all over the outside of us and all over the inside of us. And so disrupting the balance on the outside is just as significant as disrupting it in the digestive system. So what I typically and commonly and always telling my patients is to back off from using these really harsh agents and actually to keep things really clean and simple so that you can protect the oily protective barrier that's on the outside of your skin that's supposed to be there. And the other thing about using the antibacterial agents and disturbing the bacteria and causing dryness is that can actually aggravate and make worse the inflammation and irritation of your skin that is already there. And the fifth big mistake, I think, in treating acne is unnecessary food avoidance. So what I notice is that there is certainly some evidence that points to that some people, like a very small subset of the population, are sensitive to certain foods or certain macronutrients in their diet, and that tends to make their acne worse. But I have to say that having treated so many people with acne, I have treated some people who have incredibly clean diets, incredibly healthy lifestyles. They drink a lot of water, and yet they still have acne. So I don't think there really is actually a direct link that having a bad diet equals acne. Otherwise, there'd be a lot more people with acne. I think we both know that. And there are also some notion, I suppose, that food sensitivities can cause acne. I don't think they're the primary cause, but I think if someone has a food sensitivity, that the inflammation that creates can certainly aggravate their existing condition. So now I'm going to talk about what you can do to help your acne, the 6 key factors that influence skin health. And I think you've probably worked out by now that hormones are the main thing that I concentrate on, and I certainly can't ignore them at the start of treating my patients. So when assessing someone's skin, what I want to look at is what are the hormonal imbalances that are driving it. And that usually takes into account what requires of me an in-depth health assessment. So while I'm asking my patients questions, I'm trying to get an idea of, are there any other signs and symptoms, not just their skin, that are indicating a hormonal imbalance? And then usually what I recommend is some very sophisticated and specific functional testing, which we use to determine what the exact imbalance is and why it's happening. So what I typically find are the main types of hormonal imbalances are estrogen dominance and excess testosterone. These are of the reproductive ovarian hormones. And you can see from this list here what the typical symptoms are for estrogen dominance and those for excess testosterone. And if you've ever been diagnosed with polycystic ovarian syndrome, you'll probably be really familiar with the list on the right of excess testosterone. But I think also polycystic ovarian syndrome in and of itself is a much more complex condition as well. And usually what I find is that there is some coexisting estrogen dominance at the same time that gets ignored in regular treatment. So that's hormones. And I think the second one of the second areas that I deal with in treating acne is looking at diet. So you'll notice that I said before that diet is not the primary cause for most people with acne. I would say of all of my patients, about 5% of them are really, really sensitive to dietary changes. And that's mostly because of a hormone, again, called insulin-like growth factor 1. And so people who have sensitivities to that tend to notice that if they have a high glycemic, high sugar, high carbohydrate kind of diet, or if they eat too much dairy, that their acne can get worse. But those people typically are aware of that as soon as it happens. And food sensitivities for some people, and look, I really have only had, I have to be honest, only 1 or 2 people that I've treated with acne where the food sensitivities that were identified, again, via functional testing, and I think that's what's important, is not assuming what your food sensitivities are, but actually getting them assessed. And in those instances, some of those people notice that when they eat those foods that they're sensitive to, that the inflammation caused by that does contribute to their acne worsening. Now, that's the macronutrient aspect of diet. But now I think what we really need to pay attention to are the micronutrients in diet. And there are specific nutrients that our skin needs to actually repair. So in acne, it's a chronic skin condition, you know, much like eczema, much like psoriasis. So the skin's constantly getting damaged and needs to be repaired. But unfortunately, compared to an otherwise healthy person, the rate of damage is much higher. So you can see from this slide that the main nutrients to pay attention to are vitamin A, zinc, vitamin D, vitamin E, omega-3 fatty acids, and vitamin C. And I think it really is important to pay attention to both the food sources of these nutrients, but also if you have any aversions, like if you know that you're vegetarian, for example, you might struggle to get adequate amounts of zinc and vitamin A, in which case you'll probably want to be supplementing with those. And then the next factor to consider is stress. Now, stress, I think, is a really underestimated contribution to acne. And it almost seems like a ridiculous thing to say because most people who have acne are stressed about having it, which is natural. But unfortunately, stress speeds up all processes in the body, including it speeds up oil production in the skin. So usually what I find is when my patients are during high times of stress, will notice that their skin actually gets noticeably worse. And our skin is also a hormonal organ, and there's some research that suggests that stress can influence how the local androgens, so an androgen is like testosterone in the skin, behave. And stress plays a role in increasing the androgens locally in the skin. Long-term stress can also imbalance our systemic hormones. So estrogen and progesterone specifically, stress can lower progesterone relative to estrogen and contribute to that estrogen dominant-like state, as well as that stress almost always impairs sleep quality and sleep duration. So if your sleep isn't great, that means that time of the day when we're supposed to be repairing and restoring and rejuvenating gets impacted negatively, which can then impact the repair time that your body needs to repair your skin. So you can see there's many different ways that stress can impact skin health. Now, there's also that I address consistently with my patients is detoxification. And I think the word detoxification and detoxifying is kind of used in the vernacular in a more sort of that we need to cleanse our body. Certainly detoxification is about cleansing, but when I talk about it, what I'm meaning is the organs and the systems that we have in our body that are designed to detoxify our body from things that we're exposed to. So that might be environmental toxins. It might be hormones in our blood need to be detoxified and removed. It might be things that we're eating or drinking. And so you can see from this diagram here that our organs and systems of detoxification are the gallbladder, liver, kidneys, bowel, our skin, and our lymphatics. And our lymphatics are kind of tied up very closely with our skin because they're little channels that exist actually just underneath our skin next to our veins. Now, if any of these organs or tissues or systems become overburdened, for example, if you've been drinking more alcohol recently, that can place a burden on the liver, which means that the liver can't necessarily do all the jobs that it's supposed to do. For example, detoxifying hormones and getting rid of them. So stress can impair detoxification, poor digestion can impair detoxification, nutritional cofactors, if they're missing for detoxification, can impair it, dehydration, and overall toxic burden. And now I want to also highlight one of the organs that's really critical for detoxification, and that is gut health. So our digestion is made up of our small intestine and our large intestine, but I'm going to focus mostly on the large intestine. And I'm sure you didn't expect to see this fun chart in the webinar today. This is the Bristol stool chart. And the reason I put it there is because I actually use it a lot in clinical practice, because what I discovered is that most people don't know that they're supposed to have at least one full, complete bowel motion per day that looks like number 3 or number 4 on the Bristol stool chart. And if that isn't happening, there's things that we need to explore about why it isn't happening. So is it microflora imbalance in the gut, which can be caused by those, long-term antibiotics, or by toxins, or by a poorly balanced diet? These microflora imbalances can also impact estrogen metabolism. So if the contents of the gut are hanging around for too long, then estrogen can actually get recycled and then contribute to that estrogen dominance. And then if things are going through too quickly or too frequently or too loosely, like type 5, 6, or 7, then it might be that you could be eating the best diet in the world and taking all these great supplements, but not actually absorbing them. So that can equally be an issue. However, what I do find is that most people that come to see me are more on the constipated side of things. And I think that's contributing to retaining toxins and retaining hormones. So I think that the most important question that you can ask yourself at this stage in the webinar is, of all those factors that I've explained, what do you think is causing your acne? If you look at those 6 factors, is it hormones? Is it detoxification? Is it mostly your gut? Do you think that there's a dietary component? And that's what we really get into in the functional medicine approach, is finding the cause and dealing with that so that we can actually get resolution. So how to solve your acne for good is to look at to address those causes and address each of them individually. And in a functional medicine model, how we'll do that is I will ask you questions that are not just about your skin, but I'll be asking you questions about all of those systems and working out where are the imbalances and then dealing with that. And that's how we deal with any condition in functional medicine, but specifically we're talking about acne right now. And then what also needs to be done to solve acne for good and also to reduce the impact of scarring, etc., is to look at what are the nutritional imbalances and susceptibilities that you might have so that we can give your skin everything it needs to heal and heal fast. So now I'm going to hand back over to Courtney, who's going to tell you more about the functional medicine process and approach.
Thank you, Rebecca, for all that insight and sharing all that knowledge. But this is what our revolutionary approach looks like. We're going to collaborate with you to get you your results. So when you come and work with us, you get a practitioner who plays the role of detective and works out, as Rebecca's mentioned, a lot of those causes and drivers and gives you a personalised treatment plan. You also get a health coach who works closely with you and your practitioner, and they'll help you to implement your treatment plan with ease. Now, I'm sure you've all heard of a coach before, but you might be wondering, what is a health coach? So just like you might have a personal trainer to keep you motivated at the gym, or just as professional athletes have coaches to keep them at the top of their game, health coaches provide you with support and keep you accountable to help you meet your health goals. As we've learned from Rebecca already, many factors need to be addressed, and often these factors can be influenced by things like diet, lifestyle, and sleep. And we also know that change can be hard, but your health coach will guide you to implement sustainable changes so you can achieve lasting results. In our 6-month program, you'll get, as I've mentioned, your very own functional medicine practitioner and health coach. This is your little healthcare team. You'll also be provided with a personalised health plan, and you'll also be given access to lab testing. This will be guided by your practitioner, depending on your case, to help pinpoint the underlying factors that are causing your acne. You'll also get uncapped sessions and support. So this means as many appointments with your functional medicine practitioner as you require, and also as much support and contact with your health coach. You'll also have access to tools and resources to get you making the changes that you need to get your results. This is the general path we take over the 6 months. And in 6 months, we believe that that's the typical amount of time people need to achieve and maintain their results. To work with us, your personal health philosophy is really important because we're not magicians. We can share our expertise and advise you and support your health, but we can't make changes for you. Your results are going to depend on you taking ownership and responsibility of your health, you being committed to improving your health and taking action. You need to be ready and willing to make all changes. You also need to believe that your body can and will heal. But you also need to understand that healing does take time. And you'll have to maintain a long-term view of reclaiming your health rather than looking for magic bullets and quick fixes. Speaking of results, Rebecca is now going to share a few of her success stories with us.
Thanks, Courtney. I just wanted to walk you through, how we apply those principles in actual practice. So this is a patient that we'll call Sally, and she came to 6 months before she came to see me. She had a really persistent bacterial strep throat infection, and she needed to take multiple antibiotics to deal with that. And the result of that is that it disrupted her digestion significantly. She'd never had anything like this, and she became quite consistently constipated, only moving her bowels every 2 to 3 days. And then shortly after that, she started to notice the appearance of pimples around the lower half of her face and her jawline. But she was, I asked all the right questions, of course, and, she was drinking a tremendous amount of water, but but she hadn't really dealt with, remember we talked about the bowel flora imbalance, like the microbiome imbalance? She hadn't dealt with that. And so with the help of pre and probiotics, both supplementally and also from a dietary perspective, Sally started having regular bowel movements, which was important to eliminate and break down those hormones, that hormonal recycling that was happening. And so with that, her skin cleared up. So it was both the primary cause, you know, we talked about dealing with the cause, was constipation, and then the secondary effect of the constipation was a disruption in how her hormones were being detoxified and excreted by her body. The next case is a younger woman, Jenny. She came to see me when she was 26, but she'd been dealing with acne actually since she was 16. And she'd taken 2 courses of Roaccutane, and by the time she came to see me, it was 9 months into her antibiotic treatment. She was really quite frustrated with the medications that she was taking, and that they really hadn't produced any, they'd improved short-term improvements, produced those, and then eventually and ultimately her symptoms would just come back. All of her blood work was actually quite normal, and I think that's important to note that and I'll talk, well, I might speak to a bit more now actually, but sometimes, you know, when we get blood tests done, it says these are the total amounts of your hormones and everything's perfectly normal. Well, in this case, that was the case, and her pelvic ultrasound showed that she didn't have cystic ovaries, yet she had a really erratic cycle and chronic acne. Her family history was significant as well, I think, of acne and significant fertility issues, which to me pointed to genetic predisposition to hormonal imbalances. So we tested her hormones functionally using a urine test, and we discovered that the ratio of estrogen to progesterone was significantly out of balance, with estrogen being far too high. So we used herbal medicines initially to raise her progesterone whilst encouraging her body to healthily detoxify estrogen, and restored that hormonal imbalance. But there are also foods that can do that. And so when her symptoms were significantly improved, her skin was clear and she was maintaining that, then we transferred over to foods to maintain that estrogen clearance and that balance. And now Jenny has been acne-free for the last 4 years. So Courtney is now going to explain what to do next.
Thank you, Rebecca. So we know how frustrating acne can be, and we would love to support you to get your clear skin. If our approach does sound right for you, we invite you to book a call with us to determine if we're the right fit. And there are typically 3 outcomes of this call. We determine it's a good fit and we move forward to booking an initial appointment. We decide it doesn't make sense to partner, or maybe the timing just isn't right. If it is a good fit, this is what the next steps look like. You sign on to our 6-month program and we'll schedule your initial 4-hour appointment with Rebecca. The program investment is $5,800, which includes, as I mentioned earlier, as many appointments with your practitioner and as much support with your health coach that you need to get your skin better. A deposit of $720 is taken at the time of the booking to secure the first appointment as well as your place in the program. The remainder of the balance is due following the initial appointment, or it can be paid over a 6-month period using our payment partner Zip. We also have a program guarantee. At the end of the initial session, if you're not feeling very confident that we're going to be the right fit for you, you can choose to no longer proceed. If this sounds great for you, we invite you to book a call now. Here is the link, but we're also will be sharing it right now in the chat box. So click on the link and book in your call now to have a chat with one of us. Before we dive into the questions, as promised, here is the link for some skin healing recipes. So once again, this will be shared currently in the chat box, so you can click on that and download it now. But let's jump into some questions. Let me just have a look at our little chat section here and see what's come through. One question that I do know people have asked, Rebecca, is what happens in the 4-hour session? It does sound like a long time for a first appointment.
Yeah, I know, it does seem like a long time, doesn't it? And I get asked that all the time, but because the functional medicine approach is a very, very thorough approach, and we're looking at all those different factors, you know, that I discussed about detoxification and digestion, and I'm also interested to know how people's other systems, hormonal systems, are functioning. For example, their thyroid or their adrenals. So the functional medicine approach really does take into account assessing the whole of the person, which is why it does take that long. And also there might be some brief physical examination, looking at things, assessing for things like urinary health and digestive health. And then the latter part of the consultation is quite educational, because fundamentally I'm really interested in and invested in that my patients understand why what's happening to them is happening. And I really want them to be able to, over the course of the 6 months, to really build their knowledge of their own body and get really in tune with it. But that's what happens in the 4-hour initial consultation.
Wonderful. Another question that was sent through earlier is by someone that has said, I've heard estrogens are in beauty products. Do I need to avoid these if I have estrogen dominance?
So the types of estrogens they're talking about are what are called xenoestrogens, which means that they come from outside of the body. And they're not just in cosmetics, unfortunately. They're there. But they're also in a lot of pesticides and insecticides and stuff that gets sprayed on regular produce, not organic produce. They are in plastics and plasticizers, which I think is a really, really big source of them for most people. In, you know, plastic-lined tin food, plastic containers that we store our food in, plastic bottles. And they're called bisphenols. And often you'll see things that say that something's BPA free, but in fact, there are about 8 different types of bisphenols. And so I'd be very surprised to find any plastics that don't have bisphenols in them. So I usually encourage my patients, like one of the first things they do is to start storing and preparing food in glass and metal only, if possible. So I think that the main problem with them, though, is that we can't measure them in the testing because they're not the same as our own estrogen, but they can interact with estrogen receptors. And that's how hormones work. When they're floating around and in the blood, they're not really exerting a biological effect until they interact with a receptor. And so for people who are exposed to a lot of xenoestrogens, then it can start to disrupt their hormonal imbalance, but it might not actually show up in any of their testing data.
Wonderful. Another question is, how long does it typically take for the skin to heal and for people to see results when it comes to acne?
Well, when treating women, usually what I find is that their acne is coincident with their menstrual cycle. So what you'll see is changes that occur predictably throughout their menstrual cycle. They might get a mid-cycle aggravation or a premenstrual aggravation, or they might have that erratic cycle, and the erratic cycle and the acne are actually connected to one another. So we need to do the functional medicine, we need to do the functional hormonal testing at a specific time in the menstrual cycle. So sometimes we have to wait to perform the testing. And then once we have the results, we have to treat and then generally wait each month to see what's happening with the changes in the hormones. And so that won't just show up on the skin, but it'll show up in changes to the menstrual cycle as well. So it can take a few months just to tweak the hormonal prescription to notice a significant decrease in the appearance of new acne. And that's one of the main things we want to do, is decrease the appearance of new acne whilst at the same time healing the existing acne. So That's why I do allow 6 months to treat people with acne, because it can take, the first few months can simply be just rebalancing and reorganizing the hormonal environment, and then we need to spend the rest of the time healing up what's happened.
Wonderful. Another question I've got here is, does having an IUD impact that hormonal testing process?
If it's so I'm assuming it's not a copper IUD, it's a Mirena IUD, so a progesterone secreting IUD. It can.
Yeah, it's a Mirena. Yeah.
Yeah. It can. It's not as disruptive as the pill. Definitely not. But certainly sometimes I have to, in that testing process, I might have to take that into consideration when I'm interpreting the results, that there might be localized progesterone. But as far as I'm aware, actually, as I think about it and as I talk about it, it's a synthetic progestin that's in Mirena, and the functional hormone testing actually only detects your own progesterones and progesterone metabolites. So it shouldn't make any difference, theoretically.
Okay, great to know. Well, that appears to be all the questions we have coming through at the moment. So once again, thank you, Rebecca, for sharing your insight and your knowledge with us today. And also thank you to everyone for joining us as well and taking the time. Please feel free to, once again, in the chat box, the link is there to book in a discovery call and see if we are the right fit for you. We hope that everyone has got some sort of value and benefit and learned something about potentially what could be causing their acne. So thank you again, guys, for joining us. Take care, and we look forward to hearing from you all soon.